for staying with News at Prime. Today, the 5th of March 2020, will always be remembered as a historical moment for South Africa. As news of a new pandemic started spreading worldwide, South Africa recorded its very first case. COVID-19 reached our shores, with the first case being confirmed by the National Institute for Communicable Diseases, NCID. The patient was a 38-year-old male who travelled to Italy with his wife. Chairperson of the South African Medical Association, Dr. Angelique Coetzee, joins us now to discuss South Africa's COVID-19 journey. Dr. Coetzee, thank you so much for speaking to us. It has been a rather interesting 12 months.
Yes, good evening to all the listeners and viewers out there. It feels to me as if I have lived 1,000 lives in less than 12 months. I never expected this hot seat. It was a roller coaster 12 months. And looking back, I think we have learned a lot. As a country, we went through a lot, and we are still going to go through a lot. It's still far from over.
Doctor, let's take a look at maybe the reaction from the South African Medical Council when news of the virus first hit our shores.
So when this hit our shores, from SAMA's side, we didn't know what to expect. We learned, our members didn't know, our doctors, that's our members, they didn't know what to expect. How are we going to treat? There was little information available. In the beginning, you will all know that we have said everyone needs to be on a ventilator, and ventilators has been procured. And then the data came out that ventilators is not the answer. There's a certain group of people that needs ventilators, but the average person in hospital actually need high flow oxygen. And then we realized we didn't have enough high flow oxygen ports and not enough oxygen. And the procurement of PPEs, I think, and on top of it, we saw all the corruption coming out. It was really a very difficult year that we experienced.
Now take us through maybe the highlights of the last 12 months for you.
The highlights is that all of a sudden people started in the medical field to communicate. SAMA many times in the past said that we need to be able to work together with the hospitals, with the specialists, with other role players. But remember, because of the Competition Act, we're not allowed to do that. And in this case, the minister was graciously enough to lift that, and that the fact that the different disciplines can come together and work show us how needed this intervention is going forward, especially in terms of NHI. We also saw that although HR posts there's a huge problem with the allocation, there's not enough posts, especially in the public sector, we saw how hard the healthcare workers worked. Here it's the doctors, the nurses, it's including each and every one. We saw heroes emerging. People took leadership in hospitals to try to work with this. We have seen how doctors and nurses cried when they lost a patient. This is not easy. And I think that trauma is not a highlight, but that trauma will stay with us for many years to come. We also realized that you cannot always rely on other people to do your work. Different groups jump together. Highlights as well include our scientists. From SAMA side, we've got huge appreciation for our scientists that's working very hard behind the scenes. I do not know whether South Africa really realizes how lucky we are. I think we've got some of the best scientists in the world. And And if it wasn't for them, it would have taken us a long time to realize that we had a second variant. Our scientists actually alerted Britain or the UK that there's a new variant, and only then did they pick up their variant.
Doctor,
It's just amazing.
Maybe while you're there and talking about Britain, let's talk a little bit about the communication between SAMA, certainly WHO and other countries in dealing with the coronavirus and the pandemic. You obviously talked about we didn't know what to do when it hit our shores, but the virus had hit other shores of other countries days, months, and weeks before that.
Yes, that is true. So in that light, we as in South Africa, we're lucky that we were not the first ones, but that we sort of came, in the middle, more to the back of what other countries already started to experience. I think it took us 3 to 4 months later before we really went into our pandemic, or the first wave, as we call it. By that time, we learned from the other mistakes. But again, you can work together. Our scientists, our clinicians, National Department of Health, all of them worked very hard in collaboration with WHO and other countries to learn from each other. And as I've said, it's actually amazing how people come together to take hands in this pandemic. But unfortunately, there's nothing that really prepares you for the magnitude of what is unfolding in front of your eyes. And again, in South Africa, we have not been trained, and I suppose that is the same in other countries. We've not been trained really for a pandemic. I know that many years ago in the military, they were put on a high alert. They could have handled a lot of very difficult cases. But the average doctor now in South Africa has not been trained for that. And I think going forward, one needs to get teams together, put them together, and start working and preparing for this type of pandemic. This would not be the last pandemic. I think the viruses are, the evolution of the viruses, they mutate, they go forward. The fact that we can't see them with our eyes doesn't mean they're not there. So we need to make sure that we know what to do.
Doctor, maybe before I let you go, Doctor, sorry to come in there. The one thing, obviously, that comes to mind is all the frontline workers and the amount of death that they've had to deal with over the last 12 months. And the amount of trauma it causes mental health issues. What have you and your colleagues been doing to assist and deal with these issues? Very, very quickly, please, Doctor. Dr. Coetzee, are you there? We seem to have lost Dr. Coetzee. That was Dr. Angelique Coetzee, chairperson of the South African Medical Council.